pass it to me. No, I don't want one. All right. Good morning, everyone. All right, today's presentation is going to be recorded for the purpose of televising on public access, okay? The Swansea Council on Aging offers various activities and services presented by volunteers or nominally paid practitioners. Participants do so with the understanding that the Town of Swansea, its Council on Aging, and its employees do not assume legal or other responsibility for advice or services rendered. The Swansea Council on Aging is pleased to welcome and introduce Lisa Sarkis, Regional Shine Director. Lisa will be discussing the upcoming Medicare changes. All yours.
Hello, everybody. Well, it's been a whole year, and I'm back again. It did go by fast, but I have the same old thing to tell you and nag you all on. It's open enrollment, and if you need to make any changes, the time is now. Not in 2 or 3 weeks, now. After you leave today, go and do what you need to do and then forget about it for the rest of the time. Open enrollment began yesterday, October 15, and it ends on December 7, which is a Sunday, so therefore, basically it ends, the last business day is Friday, though you probably can, you definitely can call Medicare up till 11:59 on Sunday, December 7th, to enroll if you haven't done so. Now, most of you, or all of you, should have received from your current plans any changes that are going to occur. So I hope you didn't toss it in the mail, which is tempting. And if you put it aside and you find it difficult to understand, I understand that. Bring it in and let one of the Shine counselors here, Laurie or Guy, at the senior center here, review it with you, but do not ignore it. You can also give the plan a call, the customer service, and if you're lucky, you'll get someone you understand. Understand meaning what they say. I know, they talk assuming you know what terms they're using, and I know it doesn't always work that way, but sometimes you get a person who's user-friendly and realizes, they need to slow down and explain things to you. But don't wait any longer. You should have received any changes in premiums, formularies, deductibles, and co-pays. So you need to make your changes now. One good piece of information, your Part B premiums have not gone up for 2015. So you will not have any more deducted from your Social Security check. I honestly don't know what kind of increase you're getting in your Social Security this year. But I know that your Part B will not change. Some of the deductibles and co-pays of Medicare, if you just have Medicare or Medicare supplement, have changed. I just got those yesterday, from the sources to be, so anything you have here in this packet is a few dollars short. Of course, the government couldn't get those figures out in your Medicare handbooks, which you've already received, but they have managed to send me information on a couple of typos they made in the Medicare handbook, which some of you may or may not have noticed. On the cover, it says, learn more about new benefits in 2014. So they're a year late. And then the page they refer you to is an index. It's not even a page. It must be nice to get all that money and keep making mistakes. So, but that information isn't in there. It hasn't been in there for a few years. They can't seem to get the increases in Medicare, the co-pays approved before the books go to print. Your Part D plans are in the back of the book. Medicare requires them to get their act together by the book, but not themselves. And the Medicare Advantage plans, which are the PPOs and the HMOs. However, in your Medicare handbook, they're referred to as Medicare health plans. So how many here, please tell me, everybody has received their changes and knows what they want to do? Even if you haven't, has everybody received changes in their current plans? No? No? They didn't send you anything? Fallon hasn't sent? Well, that was a smart thing to do. And what did they tell you?
They're working on them. I've called them twice.
How long ago did you call them?
2 days ago.
Oh, wow.
Yeah.
Well, they should have the premiums, because I have the premiums. Maybe they're working on, new provider lists and paperwork to mail out. But if you have questions as far as have my premiums changed or my co-pays changed, they should at least be able to tell you that over the phone.
They couldn't. That was one of the things I was asking about my premium for the supplement one. No information now.
Oh.
There's something here.
Yeah, you know what? I got that yesterday. If you give me $5, I'll tell you. I can call the office before I leave and double check for you.
Maybe it's in today's mail.
Yeah, well, I just got it again yesterday as I went, and I really didn't want to kill any trees, and just, I don't want to reprint everything as the premiums trickle in. I was waiting for them all, but I will call my office and double check that for you before I leave. Okay.
So this is last year?
Yes. So so let me just backtrack and we'll get there. Well, actually, we're pretty much there. So there are two kinds of coverage you can get for yourself. You can get a supplement insurance if you want something to go with your Medicare. Plus, you need to purchase a separate Part D plan if you choose a supplement option, or if you just choose Medicare only, you still need to purchase a Part D plan if you want prescription coverage. And again, as I said before, you don't have to do anything you don't want. This is a free country. But if you don't pick a Part D plan for your medications when you're supposed to, when you need it, because now you have medications, you may not be able to get it, and if you're able to get it, you're going to get socked with a big penalty because you did not pick it up when you could have picked it up. And it's shocking to me because there are people out there that haven't picked up a Part D. I just had someone call. So if someone didn't pick up a Part D plan in 2006, if they were already on Medicare and initially eligible, their penalty now is $103 in addition to whatever the Part D premium is. So, that's scary. And I know you have enough bills. Why do you want to pay for something you don't need until you need it? But that is the insurance model that our country revolves on, whether it be car insurance, home insurance. It also carries over to health insurance. Yes, sir?
The premiums on Part D?
I'm sorry, I didn't hear you.
The Part D premium, and how much?
Yeah, actually, I have those, and we'll get to them. I have the new premiums for 2015, and there are some changes. So we will get to that in a minute. So as I said before, these are your supplement plans. If you decide to purchase something to go with your Medicare coverage, and you want the freedom to go to any doctor, anywhere, any state, any hospital, you don't want to wait, you don't for a referral, you don't need a referral, that is what a supplement plan or a Medigap, same term, is for. The premiums, as I said, some of them have gone up a few dollars, not significantly, and actually, as I look here, I believe Fallon has gone up to $108, which is a well, $108 for the core. I didn't remember what the, so maybe the other one has gone up $5 too. Again, I'll check for you. I know for a fact, Blue Cross Blue Shield has gone up to $1.76 and change. So it's gone up, I mean $1.76, $176 and change. So actually it's $1 and change increase, which isn't too bad at all. And I believe the core, instead of 92, it's 95 and change. That one, we did get that increase a while ago. And I know for a fact, when I confiscate my mother's mail, that it was in there. Another law I've broken, okay. So, you know, you need to pay attention now if you want to make a change. However, having said that, for a Medicare supplement, if you currently have one, you can change your coverage for a supplement at any time of the year. It is continuous enrollment. So if you have Medicare only and you want to join a supplement, you can. You're in a supplement that the premium has gone up more than you wish to pay, you can change to another supplement. You're in a core plan, which is the lower coverage offered from a supplement plan, you can upgrade at any time. I know it's costly, but honestly, you know, people do upgrade, especially when they know they have to have surgery the following month. So they'll upgrade to the coverage that will give them complete coverage, at least for a couple of months. Any questions on the supplements? Okay. As I said before, and we'll talk about the separate Part D plans in a minute, your supplement plans do not include medication. Okay. So, the next page are the Medicare Advantage plans, which are HMOs or PPOs. As I said before, in your Medicare handbook, they're called Medicare health plans. But otherwise, they're referred to as Advantage plans. These are the plans in Bristol County. If you have one of those plans, I've put down the premiums. And I think there's a typo. At the top it says 2015, but here it says 2014 monthly premium. These are the 2015 monthly premiums. So if you have any of these plans, just follow the name and, you know, you'll see the increase. And for those of you who have such a plan, this does include prescription coverage. If you're interested in joining one of these plans, as you notice, I've just put the premiums down. Because if you are serious about joining an Advantage plan, you need to take the first step. Call the plan, which I've given you the number. Ask them to send you a packet. Because the packet has so much more information than I can possibly put on this sheet for you. In addition to the premium, It has co-pays when you go to the doctor, co-pays when you take an ambulance, co-pays when you go to the ER, co-pays when you have a MRI, co-pays if you see a specialist versus your primary care. I cannot possibly put all that down here for you, and it's my way of forcing you guys to do a little homework. If you're so interested in this plan, you should know what you're joining and know what your responsibility will be when you need to go to the doctor, or even more importantly, if you're hospitalized, because there are, you know, co-pays per day upon hospitalization that can add up. So that's really, really important to know. I know some of these premiums here, I mean, they're on the quite high end. However, of course, as is human nature, everybody's eyes gravitate to the $27 a month plan or the $0 a month plan. And these plans have been approved by Medicare, so they're not, you know, disreputable. They are legitimate plans. However, you need to know, if you join that zero premium plan, you need to know what you are, your responsibility is to pay if you need them. So that's really, really important. I can't tell you enough. If you made that step and got the information, and again, you can't completely follow it, make an appointment with us at the Shine office, and we will explain the summary of benefits for you. Now, if you have a Medicare Advantage plan now, everybody seems to think, oh, it's open enrollment for Part D to change your drug plan. But they forget, it is open enrollment includes changing your Advantage plan, if that is what you choose to do. Because after December 7th, for the most part, there's always a little door, you know, out sometimes that we know about, but on the most part, you cannot change your Advantage plans after the 7th of December either. So if you want to make a change, you do it now. If you want to upgrade, if you want to go to a supplement and a separate Part D, and you belong to an Advantage plan, you have to do it now, October 15 to December 7. Questions on the Advantage plans? Yes?
What's the advantage of having an Advantage plan? What does it include? In other words, your regular Medicare prescription?
Correct. The question is, what is an Advantage plan? What's the advantage of an Advantage plan?
Yeah.
Well, the advantage is, or if a person, it's all your medical coverage in one, medical and prescription, so one premium. With an Advantage plan, you may get a routine physical every year, which is not necessarily given with Medicare. You get a limited eyeglass benefit, which is not a Medicare covered service. You know, so there are some preventive services with an Advantage plan that, however, having said that, with an Advantage plan, you're limited to a network of providers, doctors, and hospitals. And if all your doctors are in it, then great. But if you have a cardiologist in Boston that you've been seeing for 25 years, you need to make sure that he or she is in the plan.
And the 20% left over, in other words, is that included in here?
There's no Medicare, when you have a Medicare Advantage plan, I always tell people to kind of tuck your Medicare card in your sock drawer. Medicare doesn't pay when you have a Medicare Advantage plan. They pay the Advantage plan behind the scenes, they slip them a little money, and they say, okay, you have to take care of Mrs. Smith. So if you go to a doctor not in the Advantage plan network, Medicare is not going to help you out. Okay? Questions?
Okay. I've given you all a little visual just to rub it in of what Medicare Part D does and doesn't, how it works. What this is, it's the minimum requirements required by Medicare that a Part D must provide a Medicare beneficiary. It's minimum requirements. Many of the plans offer higher coverage than this, but these are the minimum requirements set forth by Medicare. So, you can't there's a deductible of $320. You can't have a plan that has a deductible of higher than $320. Again, as you know, many of the plans don't have deductibles or have much lower deductibles. What's the deductible? It means you're responsible for 100% of your prescription costs until you met the deductible. After the deductible, you pay no more than 25% of your prescription costs. Again, many of you know that you pay much less. Some of your prescriptions have a $0 copay, or a $2 copay, or a $4 copay if they're generic medications. Then, when you reach the infamous donut hole, you just fall right in that hole if you have high medication costs. So when you have spent $2,960, which it's gone up a few dollars since last year, you are responsible for 45% of your medication costs. It used to be 100% that you were responsible for, so I guess, you know, we should feel lucky. Of course, paying that, you know, 45, 50% of a $300-400 drug doesn't make you feel that lucky, I know. That donut hole is closing little by little and will close by 2020. Now, you might say, well, I'm never going to meet that $2,960. My copays are nothing every month, or I only pay $10 for my medication copays. Well, you may be paying $10 for your medication copays, but your plan is paying another $90 because the medication is $100. So 100 times 3 or 4 medications a month is $300-400. That is going to add up pretty quickly to that $2,960. Now, many people never meet it. Let me, you know, I'm not going to, which is great. Then there are people who meet it in the second month of the year. So it's something to be aware of. Yes?
The state does offer prescription advantage, I think they call it.
Yeah.
You reach that.
That's what I'm here for, to tell you. I'll tell you. That's okay. I'm so glad you know about it because, you know, year after year after year, people still don't know about it, and it's been around for a long time. And, you know, so having said that, it's a great intro. If you fall into that donut hole, you are very fortunate to be residents of the state of Massachusetts. The state has a program, prescription assistance program, called Prescription Advantage. And what this does is it will supplement your Part D costs. You have to have a Part D plan. It does not replace having a Part D plan. If you fall in that donut hole, and if you are a member of Prescription Advantage, and as long as we're talking about it, this is the sheet right here. depending on what category you fall in, based on your income, your medications for a generic will be no more than 7 or 12 or 18 and 30 for a brand medication. And that is much, much better than paying roughly 50% of a $200 or $300 drug. You know, there's no way around it, no excuse for you not to join this plan, this program. It is free. It is free. So really, I say this every year, no excuse. We will help you enroll. You can enroll in this plan any time of the year, not just now during program. I keep on saying plan. Any time of the year. So if you want to straighten out your Part D issues and your Medicare Advantage issues and your supplement, right now in the small window that you're given, fine. After that, you should make an appointment with the Shine counselor here and enroll in Prescription Advantage. Categories 0 through 1 are free to enroll in. Now, if your income is higher, there's a Category 5 that does cost $200 per person to enroll in. But that is if your income is quite high and your medications are extremely expensive. And we will sit with you and show you the figures at the Shine program to see if it's worth you paying that $200. Otherwise, if you meet the other category, the other income guidelines, there's absolutely no reason not to enroll. You may not be taking many medications now, but we're all aging and prescriptions change in a blink of the eye. Yes?
This is going back to Part D. If you're on a certain Part D now and you're very happy with it, your medications haven't changed one bit, that's same, would you suggest you stay on the same one?
Well, if you know for a fact that your medications are going to, the formulary has remained the same, your co-pays have remained the same, your deductible has remained the same, and your premium hasn't changed significantly.
Went up a little,
Yeah, I mean, if you've done that homework, then fine.
and I've been happy with it.
Yeah. There are some plans, though, that have changed. At first look, you say, oh, great, the premium has gone down. But now, there are plans, but now, medications that you had a zero copay for are now costing you $8 each.
Is it a big change in
So-
the Humana Walmart one? Is there a big...
Which Humana Walmart one? Which one? The 1260 plan?
The one that was 1260, that's now 15?
Yeah, well, I mean, let's look at that. But again, I just want to reinforce one more time with Prescription Advantage. Please, take 2 minutes and make an appointment with the Shine counselor before you leave. If you only come out once a year to see me and you're never going to come back here again, you can call Prescription Advantage and you can enroll with them over the phone. If they will send you a form to sign and a form that says you have to send in proof of your income. If you're really savvy, which I'm not, you can enroll online now. Brand new feature with Prescription Advantage. You can enroll online for all you computer lovers. So there is no excuse not to join this plan. It is free. Okay, so here we are, the long-awaited Part D chart. Sorry, guys, I can't blow it up any more than that, but at least I think I did it in color this year. I snuck when the financial people in the office weren't looking and hit that button on color. Okay, so put your glasses on. This will tell you if your plan has changed in premium. It will tell you if it's gone down or gone up. So let's look, for example, the first one, Aetna. The premium in 2015 is $22.10. It went down $4.20. The deductible is $320. Now, I don't know if the deductible was lower last year, but for those of you who have it, should know. And the co-pays are 0, 3, 45, 37%, and 25%, depending on, it would be generic, tier 2, tier 3, specialty drugs. Now, again, your premiums and co-pays may have not changed, but your formulary may have changed, and a prescription that maybe you had covered last year that is not covered this year, that's, it's very important that you know that. Now, I want to just say one thing. If you are a member of Prescription Advantage or join at whatever date, and you go home and, forget, go on to more important things that you think are more important than doing this, which there aren't too many, and open enrollment ends, and you haven't done anything, if you are a member of Prescription Advantage, you can still change your Part D plan. That's a perk of being a member of Prescription Advantage. If you changed your plan and in February decide you didn't like the plan that you changed to, if you're a member of Prescription Advantage, you can change your plan then. And if you're not a member, we can get you, make you a member, and then we can get you a Part D plan. But remember, you won't have coverage until we do that. So these are the plans. Take a look at it if you haven't received info from your current Part D plans. And, make your mind up. Fill out one of these forms, and we will do a drug search for you. And we will tell you if you are still in the best plan for yourself in 2015. Now let's see, I hope everybody has that form. There's a form in here. Well, I don't have it. Someone put these packets together for me. Oh no, I do have it. Let me show you. It's the Medicare Drug Plan Pre-Enrollment Form. It has the yellow on the back. If you don't have one, I will give you one. Did you have a question? Anybody here? No? Okay. This form, you need to fill it out, pretty complete. Your name, your address, your Medicare number, the effective date of your Medicare A and B. Many of you may have gotten A, but not picked up B, for a few years later. So you need to put both dates down. If you put one date down, we're assuming that you got Medicare A and B at the same time. Yes, sir?
How can you find the effective date?
You look on your Medicare card. On your Medicare card. You have, your red, white, and blue Medicare card? It will be on there. It will say hospital insurance, effective date. Medical insurance, effective date. And of course, everything is so simple with the government, hospital insurance is A, medical insurance is B, and they don't necessarily, so when I'm talking about A and B, it says on your card, hospital and medical. Hospital is Part A, medical is Part B. Do you see that? Okay. Yes?
Medicare, they said you had to take B right away or you get it.
When you first join Medicare, the question is, do you have to take B? Well, many people choose to decline B if, and only if, they are covered by a spouse, or they themselves are working, actively working, and have employer insurance. That would be one of the main reasons not to pick up B. A is free, what the heck?
Oh, you can't join it later.
You can join it later, but they're going to, again, give you a penalty.
Not right away, I mean, it's not.
Right. You have, I'm not, 6 to 8 or 8 months, I can never seem to remember, to pick up Part B when you're eligible for Medicare. However, keep in mind, in those months, you don't have any coverage if you decide not to join. You cannot pick up a Medicare supplement, you cannot pick up a Medicare Advantage plan unless you have A and B. But if you are still working and pick up A, you can decline B, have your coverage from your employer. When you stop working from with your employer, no matter what time of year it is, you can join B. If you choose not to join, when you have the 8 months from then to pick up the B. But again, you're stopped working, your insurance is covered, usually with your employer. You stop working on the 20th, it either stops on the 20th of the month, or they may, if you're lucky, give you to the end of the month. But you have those months until a penalty starts accruing. After that, after your window of opportunity is closed, you cannot join Part B until the general open enrollment, which is January 1st to March 31st. And your Part B won't even become effective till July. It takes that long to process. Haha. Especially now that Social Security is cutting their hours down left and right, it really does take that long. Okay, so again, it's an insurance model. They're going to penalize you for not picking it up when you should pick it up, unless you're employed or covered by your spouse's employer. Questions? Yes?
If you're covered by an employer or a spouse's employer, and then you retire, or fully retire, and you join Part B, are you still penalized?
No, the question is, if you're covered by a spouse's coverage, when your coverage stops, that you will not receive a penalty because you had coverage from an actively working spouse, and you have a special enrollment period, it's referred to enroll in Part B at any time. You are not limited to that January through March 31st window. You can join immediately, and you will not have accrued any penalty. And that is the same with the Part D plan also. Yes?
My employer plan is changing as of first of the year, and they're sending us an option of different plans to join Fallon. I called them, and that booklet won't be out until the end of the month, so we don't know what's going on.
The end of October?
Yeah. Now, can I fill this out using the present?
Well, let's backtrack. When you say employer, are you talking about retiree plan, or do you still work?
No, retiree.
Okay, big difference. Big difference. Let's backtrack again. When I say you don't have to pick up B when it's an employer plan, I mean your employer, not your former employer, your current employer, and you're getting up and going to work every day, or at least getting out of bed and going somewhere and getting paid. But you have to be an actively working person, or your spouse does, to exempt you. Now, some of you may have retiree coverage from a former employer. Who is your former employer, if you don't mind me asking?
Sears and Roebuck.
Sears and Roebuck, okay. So you have Medicare A and B, and you have a supplement or HMO PPO product offered from them? Okay. So they're changing. You're going to get that coverage by the end of October, correct?
We're going to get the list of options by then we have to decide which plan we want to do.
Okay, so that gives you time. What I would say, in your case, you should make an appointment with the Shine counselor in anticipation of having the information from your employer. My Shine counselor will sit down and, compare apples to oranges. If you wanted to purchase something on your own, as an individual versus what you're getting from your employer, and I'm sure you're getting a subsidized premium.
Apparently they're going to end the subsidy.
Really? Well, so now you're in a group plan, maybe the premium is still worth it, but that's even more important to look at. And many of the retiree plans, their prescription coverage is unlimited, so you don't have that donut hole aspect. So it's very important. I would make an appointment with the Shine counselor in November. And again, I can't impress upon you enough. I know that Guy is already booked. If you call Laurie, they're going to try to book another day. If Guy sees that people are calling and there's a waiting list, he will add another day. If it is just as simple as having your drugs reviewed, that's it. No employer retiree issues, no questions on your medical coverage. Please fill this form out and bring it here or mail it to us right away. There will become a point, if we receive this the first week in December, I'm going to call you up, unfortunately, and most likely tell you that you need to call Medicare and have them do the drug search for you. Because I don't want to give you false hope. I have an office of volunteers. I'm the only one that works 30 hours a week, not even full-time. So, last minute, could be a problem, and I wouldn't want you to get, fall into the situation where you didn't have any coverage. You can call Medicare now. If you choose to call Medicare now, they're open 24 hours. Still would benefit you to fill out this form. You'll have all the information in front of you when you call them. And most importantly, on the back of this form, you need to list your medications exactly. The dosage, how many times a day you take them, and the exact name of the medication on your bottle. Don't put down Lipitor if your bottle is the generic for Lipitor. Put down the exact medication that you're getting. Put down the pharmacy you go to, and put down if you like to get your medications through the mail, and perhaps save some money. And even more important than that, put down your current plan and what you pay for it. Because we can't possibly compare what there is in 2015 if we don't know what you had in 2014. And as I say every year, if you feel that you're on a limited income, well, I know all your incomes are pretty limited, but if you feel you have a lower income and you may be eligible for some public benefit, please give us a call. We'll do a quick screening for you and tell you you may be eligible to get your Part D premium paid for and to have very low copays on your medications. We may even tell you that you can have that $104.90 of Part B paid for by the government if you meet the income and asset guidelines. It never hurts to give us a call. We'll either tell you yes or no, or maybe come in with your paperwork. So please don't hesitate. Any questions? Okay, just a quick last thing. I've added this on to my presentation. I think I did it last year, concerning observation days when you go to the hospital. You go to the emergency room, you're feeling lousy. You're in the hospital for 2, 3, 4, 5 days. Then you are told that you need to go to a skilled nursing facility for rehab. You go there. And then you find out, either before or after your stay, that's to be determined. Everybody says they, that that you were never officially admitted into the hospital. That you were there for 3, 4, 5 days, but you were on what's called observation status. If you are on observation status and then sent to a skilled nursing facility, Medicare will not pay for your stay in the skilled nursing facility. And you could get one whopper of a bill. Whopper. Now, you go into the hospital, you're feeling sick and lousy. You're not going to remember what I say to you now, or you're not even going to care. That's why when you're all feeling healthy here, even though I've probably given you all a headache, bring this form home, this fact sheet. Show it to your husband, your wife, your children, your niece and nephew, your sister, someone you are close to, and let them know, this could happen if I go in the hospital. I need you to ask these questions for me when I'm not able to, when I'm feeling sick and don't know. Now, whoever asks for you, whether it be you or your loved one, if the hospital says you've been admitted, show me the paperwork. I don't trust anybody, especially when you're going to be stuck with the bill. Now, if you've been admitted, but do not spend 3 midnights in the hospital, and they send you to a skilled nursing facility, Medicare won't pay either. Okay? Welcome to my world. Well, it's your world. I just get to, see the consequences. So, you have to be 3 midnights in the hospital, admitted, to be covered when you go to a skilled nursing facility. Now, your congressmen, I have to be nice, are trying, well, I recently got a bill on my desk that, it's been passed, hooray. I'm like, it says observation bill passed. So I said, oh my goodness, I sit down and read it. And what the bill is, the passed bill, mind you, it's been passed, is hospitals are now required to tell you if you are in observation status or have been admitted. That's the bill. Okay? They haven't changed the 3-day rule. They haven't changed the fact that put in observation or admitted should be wiped out and allow you to have Medicare coverage in a skilled nursing facility. They've just had this bill, which is probably 5,000 pages long, passed that says the hospitals have to tell you. Big deal. If you ask me. Yes?
I'd like to share a story. My wife was found to have a cancerous tumor, went through all the testing, etc., and scheduled for surgery. And on the night before the surgery, I received a phone call that everything that was scheduled was out of system. Went to a hospital that wasn't covered by the insurance, the doctor wasn't covered by their plan, etc. Right down the line. And it took me over a year to get that straightened out. So,
oh my.
Remember Fallon, if you're sent to a hospital, say again, make sure that it's part of Fallon's group.
Right.
Example.
Oh, for sure. As I stressed before, if you're in an Advantage plan, an HMO or a PPO, You have to make sure you're in a hospital or see a doctor that's part of their plan. You would think that the doctor's office would say something to you, especially if you present them with your insurance card, and they'd say, oh, we don't accept Fallon. However, what's very confusing is there is Fallon for people who aren't on Medicare. You know, younger individuals through work that maybe your doctor's office accepts. But then there's Fallon in the world of Medicare. Okay? So your network for, you know, people who aren't on Medicare, you know, might be the size of a globe. But your Medicare network might be about the size of a pea. So sometimes, unfortunately, and I'll say this, and it happens everywhere, people are oblivious and aren't attentive to their jobs. If they took that extra minute and realized it was Fallon Medicare, they might have picked it up, as opposed to Fallon for people not on Medicare. You know, the hustle and bustle of the office, the people at the desk, sometimes they don't pay attention. So these are very important things to be aware of. Now, having said that about the observation days situation, if you have a Medicare Advantage plan, a PPO or an HMO, everything I said about 3-day stay, admission versus observation, does not count. They will cover you no matter what. So they jumped on the bandwagon a long time ago, the Medicare Advantage plans. However, traditional Medicare and a supplement do not follow those rules. Any questions about anything I've talked about today? Okay, just please remember, you need to review what you have. And I understand, believe me, that it's a chore, and looking at it, is overwhelming. And you never seem to have enough time. But just take the time to make an appointment here, and we will help you with it. Okay, good luck to everybody. Have a great year.
Thank you.